Well, good afternoon and good morning, everyone, depending on where you are in the US right now or around the world. We're glad you're here for COVID-19 year 2. The task force has now been in existence since March of 2020, and we continue to try to make sure that we stay abreast of all the topics and provide you information, which is a challenge because it changes almost daily in some cases, and sometimes it seems even faster than that. So again, welcome. As Andrea said, we're recording so that we can share this information with the music therapy community broadly, and we're glad to have you all here today.
Sick now, droop now, this sickness doth infect the very lifeblood of our enterprise.
So this quote from Shakespeare's play, Henry IV, is striking even today, and in light of the pandemic, as it affects music therapists and our practices on many levels. This juxtaposition of values, perspectives, and struggles in Shakespeare's play exists on many levels in his work. And just as Shakespeare explored moral conflict and struggles, the pandemic forces music therapists to face and explore moral challenges, as well as we reflect on our clinical practice, personal and professional works in the midst of this pandemic.
Andrew,
so
there we go.
The first thing that I want to do before we start is introduce everyone, because this has truly been from the start a collaborative effort, and everybody contributes equally, and everyone brings a huge amount of expertise to the table from their own careers and own paths as humans and as music therapists. So our MC, so to speak, today is Andrea Dalton. She is our tech whiz and our facilitator extraordinaire. She keeps us straight with all of the tech. Next, we have Seneca Block. And Seneca comes to us from Ohio, where he's working in healthcare. And so he stays very current because he is quite literally living with the changes day in and day out and brings a great amount of knowledge from that. Following Seneca is Barbara Els. She's giving you a wave there. Barbara's our Shakespearean reader this afternoon. And Barb is a consultant for AMTA, and she also brings a huge amount of knowledge, particularly from her past experience with organizations like the Red Cross and disaster response. And so that's been hugely helpful. I'm Lori Gooding. I'm a professor at Florida State University. And so my job is just to facilitate and organize and get out of their way so that they can do the really good work that they do. And it's been an honor to do that. Following me, the next picture you see is David Knott. David is another music therapist working in a healthcare setting. He works out on the West Coast in a pediatric setting, and he's brought some really fantastic information, particularly in light of the challenges with things like singing and masking and all those kinds of things, switching to telepractice or not, and so on. Next to David, you'll see Rochelle Morgan. And Rochelle is one of our, in addition to Andrea, one of our Midwesterners that brings for us a really valuable perspective from our music therapy business owner community. And she's really kept us grounded in what the needs were, particularly when people were having to switch so rapidly and trying to just quite literally hang on and survive in the initial stages of the pandemic. And then last but not least, we have Heather Wagner, who is our New England and Buffalo's Bill fan, as she pointed out earlier, our New England representative, who is another faculty member as well. And so she also brings a huge amount of information in connection with her work in things like resilience, trauma, and various other things. And that's also been hugely helpful. And I want to say, and I've said this many times to them, how much I appreciate all of them and just what a tremendous honor it's been to work with them. And the true collaborative nature of this task force has been tremendous. I think we've been able to accomplish what we've been able to accomplish because we have worked so collaboratively and collectively, and I'm grateful for that for many reasons. Okay, Andrea, we can go on.
So we're going to start a little bit talking about music therapy in the public health perspective. And while the aim of our session is to provide an update, we may not have definitive answers to everything, but we're trying to help provide a path forward in this pandemic and think about a path of reasoning, and our critical thinking and ethical problem solving is part of that. But let's begin with music therapy in the public health perspective, sort of the big picture umbrella. There are multiple factors at play during the pandemic that can influence our thinking, decision making, and our professional behaviors in clinical practice. We've been living it for the last 2 years now, it seems to me. The reality is oftentimes that these factors include the presence of competing ideas and information. So all of these factors and influences can be thought of as a funnel or a sieve. And as my team knows, I'm a big fan of ice cream and funnels and images like that, probably because I live in the desert. But let's start from the top level, starting at the broadest perspective on the funnel image. At the top, there are 5 circles, sort of like marbles going through a funnel. The broadest perspective includes and takes place at the societal level. And it can be characterized as a collective traumatic experience around the pandemic, as well as due to societal influences going on in present day. Our collective experiences all take place concurrently in the context of the public health perspective in our society. That's a second marble that's sitting at the top of the funnel. So from a public health perspective, one can think of health as a public good. And that term, just as we have public parks and tax-supported services like clean water for drinking and waste systems, those are all public goods. So public health of a community or a society is also a public good. A community's health, it's considered a public good even in the face of weaknesses and flaws in the organization of the services and systems at the federal, state, local level that might be provided, and institution level even. At the federal level, it's sometimes considered a matter of national security. So an example of that was early on in the COVID pandemic, there was an onboard outbreak of COVID on a US naval ship, and that was considered a national security issue. So moving down the funnel are these marbles going through the sieve at the level of the practicing health professionals. The perspective and the notion is to do no harm, quote, unquote, do no harm. Then slipping over to the professional practice level among music therapists, the values perspective is critically important. Values outlined in our scope of practice include, quote, non-maleficence, beneficence, ethical practice, professional integrity, respect, excellence, and diversity, unquote. The first assumption on our scope of practice is public protection. And it says, the public is entitled to have access to qualified music therapists who practice competently, safely, and ethically. So finally, another last perspective as we drill down to the clinical practice level is the patient-client safety is primary, paramount. And it's paramount, and that includes the physical, emotional, psychological, and moral safety of the clients and patients that we work with. I'll pass it over to Lori.
Great, thank you. So the relationship between public health, research, and science is really important. So Andrea, if you'll go on to the next slide, please, ma'am. Okay. We're going to talk about music therapy in the context of public health. First, in the relationship to considering music as a health promoting resource, and also recognizing that music in public health is an interdisciplinary arena. I wouldn't necessarily say it's a formalized field or specific aspect of music therapy in and of itself yet, because it's very, very new in terms of its conception. But the idea that we connect with others who are working in the public health sphere to use music as a health promoting resource is important. And one thing I want to point out as I'm saying that is just to encourage all of you, if you have not, to go to the Sound Health website. And the Sound Health website looks at a number of different aspects of music in relation to health and well-being. And there's a directory there, and I believe we're going to be dropping the link into the chat so you can have that. And it will also be included on the resources slide at the end of the presentation. But if you have not done so, I encourage you to go there and look at this website and list your name as a music therapist so that you can be in the directory and people can reach out to you if they are interested in hearing more, learning more, or connecting with a music therapist. And that's one of the ways that we will be able to really grow our participation in things like public health. So as we go back to the science and the research aspects and how that informs public health, let's talk about a few different things.
Yeah.
So go ahead, Barb.
I'll pick up on the definition real quickly here. So I want to be sure and read out what it says on the slide as well. A gentleman named Winslow founded the Yale School of Public Health back in the 1920s and said he defined public health as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. And so we've laid out the slide with sort of a balance between the interplay between science and research and how that informs public health advisories and recommendations. And even today, and more recently, the Institute of Medicine noted public health is what we as a society do collectively to assure the condition in which people can be healthy. And I think I put that Institute of Medicine in the resources references as well.
Great. Thank you, Barb. So as we look at and continue to consider the science and the research and their connection with public health, we want to just highlight a few things. There are a number of things that are happening and a number of studies that are happening, research that's being driven by the pandemic, some of which were areas that were researched before and others that are new, understandably so, because of what's currently happening. So at the federal level, many of you know that the FDA has been reviewing all of the various vaccinations programs and looking at them in terms of boosters or second doses or various other languages being used or reviewed. And we're going to give you some updates on those in just a moment in terms of where we are with some very, very recent announcements. I think some as recent as yesterday on some of the various vaccinations or vaccines out there, excuse me. And then of course there are advisories and recommendations at the state level. And that comes from state, and then within that state, you even funnel down further into the county or districts or various other things where you get information. And these often can be helpful, but yet also very confusing because the recommendations, policies can change very rapidly. And so one of the things we tried to do is keep you guys abreast of what we can in terms of widely available information. And then there are other aspects as well that are more area specific, like the NFHS information you see here on this slide. So this slide is showing the website for the NFHS, and it's giving you just the overview of the unprecedented international coalition led by Performing Arts Organization to commission a COVID-19 study. So the NFHS which is the National Federation of State High Schools Associations, has been conducting research for the majority of the pandemic at this point, and they periodically give updates on music activities in terms of what is considered most current, most reliable information on practices that are going to keep musicians and those engaged in musical experiences safe. And I believe the August 31st update was the most recent one. The link is here on the page, and then the link will also be included in the resources slide at the end as well. So we encourage you to go there. This is national in the sense that it's a national federation, but this is very specific to the arena of music. And they have some great information and guidance that you can use to help you as you make some ethical decisions, which we're going to be talking about a little bit later in the presentation. Okay, so speaking of some of those updates that I mentioned that we were going to get to, I want to take just a quick moment to remind you just of a few of the most recent changes. So the Pfizer vaccine has been approved for the booster dose for some time now, and the Moderna vaccine was also recently approved as well. Right now, that approval stands for individuals 65 and older, adults 18 through 49 with underlying medical conditions, those in long-term care facilities, and those at increased risk due to their job, things like first responders, educators 18 and up, et cetera. Right? And so certainly here is a situation where music therapists may fall into those at risk due to their job, as well as some of the other categories. So there is some information on our website, on the COVID-19 web pages, that can help support you if you're talking to an employer to make decisions about vaccination. Right? And so we encourage you to go to the COVID-19 web pages, and we'll drop that link to our web pages in the chat in just a moment so that you can have those. And just use some of those resources that exist. We also always welcome people reaching out. If there's something that you need that you don't see or doesn't work for you on the website, please reach out to us and we can take a look at it. Now, the J&J second shot was also just approved. And if I am correct, I think that was actually yesterday or either Friday. So it's very, very recent. This one is being talked about a little different, not so much in the sense of a booster, but more of as a second dose. And so be aware of that and look at and consider what you've gotten in terms of which vaccine you've been able to get and what access you might have. I would also encourage you to continue to watch, because there's some discussion on whether it's going to be safe or efficacious or not to mix vaccines. In other words, get the J&J for shot 1 and the Moderna for shot 2. That is being talked about, but there's not definitive information yet at this point. If you need information on vaccination centers in your area, you can text your zip code to 438829. Again, you can text your zip code to 438829 if you need information on vaccine centers. And I'm going to hand it over to David.
Okay, great. Thank you, Lori. So we're in this context of all this vaccination happening, and we're anticipating that we're going to have a large number of younger children being eligible to take the vaccine. On October 7th, Pfizer filed an application with the FDA to approve the vaccine for ages 5 to 11. And the American Academy of Pediatrics reports that 28 million children live in the US between the ages of 5 and 11, and that actually children are accounting for 16.4% of new COVID infections. So this sort of confluence of these issues is leading us to think that there's going to be very soon a large number of young children that are going to be anticipating vaccination. And this really presents an opportunity for music therapists to aid these efforts through our advocacy, direct service, and consultation. Next slide, please, Andrea. Thank you. So music therapy for procedural support's a really broad practice area, and there's a lot in the literature supporting this. And it's in support of a wide range of medical treatments. But today we're going to be talking specifically about vaccinations, what's also sometimes called needle-based procedures. We all fall along a continuum between needle phobia and mild displeasure with being poked. Unfortunately, some children and adults with developmental disability can really suffer from the fear and anxiety, and some may even avoid vaccination because of these stressors. So there's really a lot that can be done even before the vaccine appointment that can help reduce that distress. Being honest, open, and excuse me, making preparation based on an individual's disposition and preferences is really the best strategy. But sometimes, despite all these efforts, some will have real difficulty coping with getting the poke, and that's where music therapy can help. So, thank you. So what is procedural support to aid vaccinations? I'm going to give you the most reductionist, super basic description. It's live, interactive, and receptive techniques that refocus attention and reinforce breathing, positioning, modeling, and relaxation in order to reduce distress, improve coping, and help children calm, recover, and return to baseline. Now, music therapists with expertise in providing procedural support may be able to provide direct service or consult. But because of our foundational training and the uses of music to improve health, we can all be advocates for both music therapy and other music resources. And a resource that you might find helpful is a PDF that's available on the AMTA website, Music Therapy and Procedural Support to Aid Vaccinations. It's there on the slide, and it's also in your resources page at the end of this presentation. So as we were saying, all of us can share these resources in this area. We can all be advocates for music therapy, and also the other music resources that are out there, like songs that teach the importance of getting vaccinated, or that teach techniques that help cope, or even just normalize the experience by creating positive associations through the music. So if you have expertise in this area, you can collaborate with staff that have different skills and perspectives, child life specialists, nurses, social workers. Basically, how can we all work together to identify how to maximize the use of music for preparation, environmental support, and procedural support? And we can triage. So as part of that collaboration, we can help identify an escalation path for music therapy support for specific individuals that have that high need and may benefit from the procedural support music therapy. So again, depending on your expertise in this area, consultation may take the form of preparation, recommending pre-vaccine planning, or assisting to tailor a developmentally appropriate vaccine music plan, or knowledge sharing. So if you have the expertise, you can provide in-services, caregiver consultations, or printed resources for your local vaccination efforts. So ultimately, we in our community can amplify these resources across our networks, sharing articles, vaccine songs, and links to additional information. And if you're not comfortable with that, if it's not within your skill set, you can always direct inquiries that come to you to the AMTA. And just as an example of one of these really great songs that are out there now, we wanted to share just a short little bit of Cootie Shot that's written by Pierce Freeland featuring Divinity Rocks. Just wanted to share that as a little example of some of these really creative resources that are out there that we can use when people turn to us about our experience and our expertise in this area, just as additional resources to help support kids that are facing this tough time. And I'm going to hand it off to Rochelle.
Okay, thank you, David. So we're going to turn now from the updates of what's going on in the wider world and shift towards what we're dealing with as individual music therapists, each of us in our own corner of the world. A year and a half, approaching 2 years into this pandemic and figuring out how to deal with things. So the lens that I'm going to be talking about is ethical decision making and using our AMTA Code of Ethics to think through some of the sticky situations that you might be facing as we move through this pandemic together. So on this slide, I pulled out some of the things in our Code of Ethics that really apply as we are in this part of the pandemic. And our core values, 3 that really apply, are social responsibility, equality, and courage. So social responsibility, when we're thinking about public health and our responsibility as music therapists to the public, when we're thinking about things like policies regarding masks or social distancing in our music therapy practices, I know that for me personally, I'm following the recommendations to wear masks when I am doing music therapy face-to-face with clients. But in my part of the world, in Missouri, I've had some pressure from clients and family members to take my mask off, even when it's not clinically necessary for that to happen. So this idea of social responsibility and modeling behavior is something that I think about. Equality, making sure that people have access to services, making sure that people who possibly are immunosuppressed can still have access to services because other people around them are doing the risk mitigation strategies that we know are working. Courage is another one of our core values. Sometimes it takes courage to make decisions that run counter to what the people around you might want you to do, or what your clients might want you to do, or what their family members might want, or your organization might say. And so we can lean on these core values when we're trying to figure out how to make decisions in our clinical practice, in our business decisions, and in other decisions that we're making around our practice during this COVID-19 pandemic. I pulled out 2 specific pieces of our code of ethics. 1.3 says that we need to respect, acknowledge, and protect the rights of all clients. And this includes the right to safety. So while we're thinking about these big public health things that are changing rapidly in terms of getting booster shots and getting vaccinated and following mask mandates and choosing whether to have mask mandates in your business and things like that, we need to acknowledge the right to safety. We also need to acknowledge the right to access to music therapy services. And that is in our code of ethics, something that we are aspiring to. Another one that we pulled out here is 5.3. This tells us to use caution, critical thinking, and strong consideration of the best available evidence when incorporating new and evolving interventions and technologies into practice, education, or supervision. This is tricky for all of us right now because we have new stuff coming out all the time. We have new research coming out. We have new research about that research coming out all the time. And so the best available evidence is changing. So it's incumbent upon all of us who are practicing ethical thinking to look for the best available evidence when we're trying to make our decisions. We had I can't even remember where during this conference, somebody made the suggestion, but like taking a Post-it note and writing down, this is the day that we made this decision. And I made this decision based on the knowledge that I had at this time. And sometimes you have to make a decision and move forward and then be willing to change that decision if it becomes clear that it's no longer accurate, or based on information that's no longer accurate. But part of this ethical decision making that we're going to be doing is to use caution and critical thinking. So if we go to the next slide, I think we have an example here of how we can apply some of these ethical thinking skills. And here we're thinking about ableism and clinical decisions that you might be making during during this COVID-19 pandemic. So the specific question here is whether to provide services by telepractice or in-person services. This is something a lot of people have been wrestling with as the Delta variant has come through and the rates of infection have been higher. Seem to be coming down again, but we may be anticipating another raise in infection rates during the winter months. So one of the questions that has come up is, are we paying attention to disabilities or the needs of disabled people when we are creating policies around COVID, risk mitigation strategies, or when we are trying to follow what we're seeing as the best available evidence? So for example, there are lawsuits in states such as Florida, Tennessee, Iowa, South Carolina, Texas, and Utah on whether mask mandates are discriminating against people with disabilities. So for some people, if there's a mask mandate, that makes it more difficult for them to access services, perhaps because they can't see people's mouths moving, and so that makes it more difficult to communicate. There could be other reasons as well why that could be something that decreases access to services. On the other hand, if we're not using risk mitigation strategies in our practice and it increases the risk of a virus going around, then people who cannot be vaccinated or who are immunosuppressed for one reason or another, maybe we're restricting their access to services by setting a policy that does not use all of the best risk mitigation strategies that are possible. So we have to weigh all these different factors. There's no straight answer. There's a lot of gray area in this, and so it can get very complex. Weighing all of these different factors is something that's really important for all of us to practice as we are practicing this ethical decision making. It can be challenging. I'm not going to lie about that. It's not easy, but it is very important that we're willing to walk through that process and to use the best available evidence, use our resources, our peers, the resources that are available to us as we make those crucial decisions in our businesses and in the organizations where we work. I'm going to pass it off to the next person, Andrea.
Thanks, Rochelle. And I think what you're talking about here flows really well into this idea of how we're impacted then by sometimes those decisions that we make, because we are faced with a lot of competing obligations. We already had those, and then the pandemic in a lot of ways, I think, has exacerbated the conflicts that we may have in our own, ethical decision making and those moral, the way the moral obligations kind of line out, the things that we owe to each other, to our patients, to our families, to our friends, and to ourselves as an individual, as a human being, along with everyone else. And so these situations that we're in with, having to decide with the evidence that we have at the moment, sometimes we look back on those and we think, gosh, I wish I would have had this knowledge then, or we feel maybe pretty bad about the decision that we made. And then we have, threats to our safety, threats to the safety of others that we care about. And, anytime we have a threat to our safety, that often contributes to our fight or flight response. We may have hypervigilance. We may have a higher sense of responsibility because of that. And so these decisions that we're making in the midst of all of this are impacted by that as well. And every decision we make has impacts then on the health and safety of ourselves and the people that we're serving and that we're working alongside, and our families and our friends. And that can lead us to feel overwhelmed, stressed, worried, conflicted. And that distress often arises because we know the right thing to do, and we may not be able to do it because of some kind of external constraint. And we may also experience that kind of distress because we observe or we witness something happening to someone else, and we couldn't or didn't step in to stop it. And so this idea of moral distress and injury, I think, becomes a really important part of our conversation in how we are responding to the pandemic. And the range of responses that we have exists kind of on a continuum from moral frustration to a little more intense moral distress to a very intense moral injury. And that comes as a result of these moral challenges or stressors that often involve some kind of betrayal or transgression of our own deeply held beliefs and values. So this ties back to what Barb was talking about earlier with some of those marbles in the funnel. The higher the stakes in the situation, often the more severe and long lasting the impact of these types of situations. And moral injury in particular is characterized by enduring psychological, social, and spiritual impact on our self-image and on our worldview. So oftentimes we may feel unforgivable. We may feel detached from our sense of self or from our own identity. We may experience signs of depression. We can be at a greater risk of suicide as a result of intense moral injury. And in those situations that are work-related, we may show signs of burnout, which can make it then even more challenging as we are engaging in that ethical decision-making that we have to do sometimes every day as we show up to our workplaces. And so an important consideration in our discussion of moral distress and injury is that many of these situations, especially in the healthcare setting, are a result of systemic problems. So we have policies or practices that have been enacted There are financial or maybe insurance related circumstances. The demand is so great and that exceeds our capacity. Um, and even though those are systemic issues, they have a personal impact on us. And when we witness the pain of someone not being able to be with a loved one at the moment of their death because of visitation policies, or we see people unable to access care and services that they really need, or we're not able to go in to provide the service that we know they need. And so we empathetically and directly experience this pain. And then we go home or we go in our community and we experience conflicts over personal rights and responsibilities. We may be considering some of those things that Rochelle talked about with ableism and how some of those policies and mandates that are out there are impacting individuals that we know in our communities. And then, we ourselves maybe have had to quarantine. We've lost loved ones. We've lost income. We've lost connection with others. And so this becomes very heavy, I think. I think we're going to experience the effects of moral distress and injury for a long time. And I think what I want to say about it is that these are real experiences. They have real impact. They're not something we're just going to get over. There are processes that we're going to have to go through to heal, to grieve, to move through it. And we can heal. And I think that's a really important thing to say too. We can heal. We do heal. We're forever changed because of these kinds of experiences. And yet we can integrate that into our worldview and into our self-view and hopefully move forward in a way that is going to be really better for our communities, better for our families, better for each other. So I think it's also important to note that to some extent we can protect ourselves a bit from these experiences. We're not going to be able to completely, take ourselves away from it or ignore it or anything like that. But there are things we can do for ourselves as we show up in these spaces where we're having these types of exposures to moral challenges that will help us to protect ourselves. So I'm going to pass it on to Heather to talk about that a little bit.
Thank you. So when we think about, what is it that I can do? So you're feeling all of these things that are real and that we're experiencing together at various levels at different times of your day, of your week, all of those things. So these four sort of tips that kind of help us get through can help us to alleviate and to work through some of this and to not just that, but to also mitigate some of its impact on our everyday lives and functioning. So the first is to distinguish what it is that you're feeling. So are you feeling moral distress or burnout or even compassion fatigue? All three cause distress, but each have a different mitigation strategies that have found to be effective. So focusing on moral distress, the way to really know, am I feeling, what is it? I think we have a better understanding of burnout and of compassion fatigue. But moral distress is becoming more fully defined as time goes on. So it becomes clear when we are in situations in which we begin to ask ourselves, is this the right thing to do? So if a sense of conflict arises, we may ask ourselves, am I a good person in all of this? Am I doing the right thing? And I do believe if you're experiencing some of the same things I haven't felt that to the level that I have felt during COVID-19 that I have in other times in my career. So our experiences providing care during the pandemic have certainly exacerbated this sense of moral distress in a way that I've never personally experienced. So the second then is to identify the causes and the constraints. So, sorry, is that the right causes and constraints? Yes, mine's tiny on my screen as I'm reading notes, sorry. So recognize the situations and factors that contribute to your moral distress. So this will help you to determine your own next steps, right? There's no formula, do this and this and this. It really will depend on your situation. So it's important to understand your competing obligations and how your personal values are being challenged. So even the simple act of reflecting can give you a moment to pause which may help you to regulate and focus. So when those thoughts come quickly and it feels like we can't quite process, it makes it more difficult to make good decisions. And this reorientation will help us to respond rather than to react. So third is to gauge the severity of your distress. So familiarize yourself with your symptoms and then rate your stress on a scale of 1 to 10. And this will help you to prioritize mitigation efforts. What needs the most attention? So some of these symptoms can be physical. You may have GI distress, headaches, body aches, tiredness. You may have psychological and emotional issues, emotional lability. You might feel like you're overreacting, right? But it's our emotional responses, which then can lead to compounded stress. And then finally, take action to help yourself to move forward. So consider all your options for addressing your moral distress. What are your personal resources? Does your workplace offer resources for you? Does your community or music therapy community offer resources for you and beyond? And it's so important to reduce isolation, which I know has been one of the major factors in the pandemic overall. Even as we start to reintegrate into society, there's my personal experience has still been a sense of isolation because I'm not doing all of the same things that I used to do. I'm not comfortable yet doing all the same things. It does help to feel heard or listened to, particularly when you're facing situations that are activating this sense of moral distress. It helps to have someone to process that with. So the question then is, what is your, I love this phrase, personal protective strategy? So Andrew, if you could click over, yeah, thank you. So this phrase, at least I found it coined from, her name is Dr. Cinda Rushton. She's a professor of clinical ethics at Johns Hopkins University School of Nursing. And she really began by focusing on moments of gratitude and connecting with what went well. So this isn't that, we're encouraging toxic positivity and to always orient to what's great about life and not what's bad about it, but instead finding those moments of shifting focus in order to remind ourselves that there can be good. So there's a moral injury guide, which gives us these, 6 things that you can do to help yourself develop your own personal protective strategy. So the first is psychoeducation or education. So accessing psychoeducational materials about moral stressors and moral injury. Being here is one way. So recognizing your reactions. So again, how do you respond? What is activated in you? Maybe avoidance, numbing, maybe you feel shame for the decisions you've had to make, and encouraging early help seeking. So getting help sooner than later before it becomes an even bigger problem. So the next is to engage in trauma-informed stress reduction activities. And I love that the focus is on trauma-informed, right? So some of the things like mindfulness, meditation, breathing and relaxation therapies, self-compassion and acceptance. And then we go into our self-care, right? Attending to our self-care, which is, at least everywhere I work, self-care has always been the big buzz, and it's gotten even bigger during the COVID-19 pandemic. But thinking about all the ways that you can take care of yourself beyond the standard, eating well, exercising, but also actively creating and maintaining your social connections. We can't understate the importance of rest, not just sleep, but rest. And those restorative activities, the things that bring us I like to think of them as bringing me back to life, what infuses life back into my everyday. And when needed, taking time off, which I know is not the easiest thing to do sometimes, particularly when you're feeling that pull to provide services. And if you were like me, early in the pandemic, a lot of my clinical work was shut down. It made it really hard for me when it started back up again to take time off because, first of all, I lost finances, of course, but also lost the ability to provide services to the people who I know were benefiting. And so even now, a year later, it's been a year since I've pretty much fully been back into my clinical work. I still feel this sense of hesitation to take any time off because I don't want to lose that time with my clients. Next is to access and provide support. So supporting each other as colleagues who understand shared experiences, and seeking professional support when needed. So if you are distressed or troubled, or it's getting in the way of your everyday life and ability to experience your life in a meaningful or joyful way, access the help that you need. And finally, the idea of cultivating moral resilience. So moral resilience can help. It's important for us to acknowledge that we are making difficult decisions every day, and more difficult decisions than perhaps you've ever had to in your clinical practice and your personal life as well. And we are being asked to respond in ways that sometimes don't feel good. So can we find ways to respond that helps us stand strong in our integrity? And can we focus there? Which leads us to the silver lining, so to speak. And I'm going to allow Seneca to take over from here. Thank you. Yes.
Great, thanks, Heather. And I think that does lead so well into the silver lining. Before I start, I would first like to thank Libby Gill for giving me permission to use some of her material for this slide. And we're going to talk about the post-traumatic growth, the silver lining. I was joking earlier with the group that I wrote a tune this morning called that, and it's about finding a pathway forward. So really, post-traumatic growth is about asking this question. It's about asking, what have we learned, and what benefits from experiencing trauma can come to fruition. It also asks us, when we are forced to confront deep-rooted existential questions about self and purpose, what good comes of it? Research shows us that about 17% of the general population has experienced PTSD symptoms during the initial stages of the pandemic. And that percentage has increased exponentially. What's interesting though, meta-analyses also show that 50 to 60% of people exposed to post-traumatic experiences also may develop post-traumatic growth in some domains. So post-traumatic growth is the perceived benefits or changes in self-perception, interpersonal relations, and in philosophy after a traumatic event. And I want to share a short personal story. I know, just along with everyone else, that as we mentioned, that we're working the front lines within a medical center, and we have vicarious trauma happening, and your experience, within this world of chaos. I also found myself, struggling with things like lack of exercise, stress, poor coping habits. And it really left me questioning my own purpose and my own life goals, which was one of the first times in my life. But over time, a balance slowly returned and shifted into this phase of post-traumatic growth that led to what I felt like was actually an additional and deeper understanding of self. And over time, it also led to positive coping mechanisms, better music, better exercise, a better nutritious diet. And interestingly enough, I found that those domains actually became better than pre-pandemic. My health is better than pre-pandemic. My mental health is better than pre-pandemic. And this experience of post-traumatic growth is something that helped with a feeling of openness to the future and identification with humanity. Now, with that said, I think this is a spectrum that everyone will experience very differently. And I'm sure it will wax and wane with everyone. But just as a topic, we thought it was important to share because it is a moment of silver lining for us. And if you're not experiencing it now, I hope you do at some point in the future. And it's something that can maybe help us get through this one step at a time. With that said, I'm going to pass it back.
Thank you, Seneca. And thank you all for the things that you've been putting in the chat. We appreciate your willingness to share all of those. And along those lines of sharing, I think we're actually going to stop now and take a moment to share a little bit more collectively. So thinking about our own personal protective strategies and all of the things with moral injury and post-traumatic growth that we've just been talking about, we'd like to give you all some time to take a look at the whiteboard that's here, and just write what comes to mind for you, in your own personal protective strategies, or any other things that are just coming to mind as you write. So if you've not used the whiteboard before, go up to the top and click on View Options. Click on the little arrow to the right of the word View Options. And then if you will move down, you should see the word Annotate. Like Heather's already gotten one up there, and she's put our question: what are your personal protective strategies? Okay. So when you click on the word Annotate, a toolbar will pop up and give you lots of options. You can write, you can draw, you can put stamps, all kinds of things. So we're going to give everyone a moment just to sit and think, and to kind of sit with what we've been talking about, and then take some time to answer that question if you feel encouraged to do so.
And if you can't access that for some reason, you're welcome to type in the chat, and one of us can put it in the whiteboard as well.
Okay with everyone, while they're popping up, I'm going to read them out loud so that we can see what's happening. And there's some coming in on the chat as well, but I see playing my guitars, a nice heart here in the middle, lyric analysis around self-affirmation of core values. It's reading a book in the mornings, GIM, and I happen to emphasize that with some extra hearts as a GIM practitioner myself. Watching funny movies with my kids, I also put some hearts around that too. Trying to preserve a sense of balance and wholeness in life. Yeah, walking my dog, calling a friend, movies and table games. Got me a new rowing machine. What a difference on the exercise front. Yes, I think there's a lot of us who have invested in some home fitness equipment that has made life a little better. Gardening, hiking, and nature. Yes, talking with family and friends and family. I may have said, but riding my bicycle, taking naps, indeed, getting away from my desk, oh, right, and driving to get a cup of fancy coffee, yeah, daily walks with my spouse, exercise, I see some stars popping up too, mindfulness practices, cross stitch, running with a yes, coming from band geek to band mom, I think I know who typed that, reconnect with my support network, yeah, with a star and a heart. Oh, that's supposed to be, this is mine, so I know it's supposed to be Peloton workouts. There we go, whatever. Reading, walking outside, going on long runs, yes, keeping a ukulele next to me during virtual meetings and we're playing. That's great. Keep my heart by my desk. Yeah, lots of music ones here. I see more hearts popping up. Seeing if I missed any. Oh, opportunities to feel grateful and hopeful. Yes. And then in the chat, there is working out every day, getting some type of nature walk in on Sundays. Yes. Chatting with friends. Perk play. I think you mean, is that percussion play, Teresa, I assume? Charla says spiritual pursuits. Yeah. And did some new ones pop up? Feel free to draw too. You can add colors. You can add, if you've seen the stamps, you've got the stamped hearts and stars. I love it. Spiritual pursuits, there it is. Yeah. Playing. Oh, good. You're typing them in. Thank you. And Felicia writes, connecting, venting with people. Yes, and realizing you're not alone in your experiences, feelings, and thoughts. Indeed.
Yeah, I'm getting the ones from the chat in there.
Thank you. Thank you, Andrea. And what I love about this exercise is that it helps us to see, number one, maybe some things you hadn't considered that can be part of your personal PPE, but also the commonalities that we share with each other, that even through this, there are things that we're doing that other people are doing, and the emphasizing of some. Yes, I see walking my dog has a whole bunch of hearts beside it. Yes. Yoga, I see. I didn't see that one before. I see some arrows. I just can't quite see it big enough. Someone wrote in an arrow down there pointing at the ukulele.
I think the arrow just has the name of the person who puts
Oh,
the
God,
arrow.
I'm sorry.
Yep.
Thank you. Thank you. Puzzles. Oh, I have a soulmate there. Puzzles. Yes. Barb, playing my flute. Yeah. Amanda says this would be fun as a word cloud. Mentimeter is a yes.
Mhm.
Mentimeter. Yeah.
Mentimeter's fun.
Fun activity. Gardening, hiking, nature. Flute
This is
equals
beautiful.
Barb, it's funny, and I hope it's okay for me to share my personal experience. I am back to playing in an orchestra. Talk about moral distress, because it's not without concern, quite frankly. I mean, I'm wearing my flute mask and all the strings are masked, and we're doing the mitigation strategies as appropriate. It's a requirement to be vaccinated, which I appreciate, but we're still pretty close together. But I'm a flutist. We had our first rehearsal a couple weeks ago, and I was nervous about going. But I noticed in the moment, the act of breathing, playing my flute made a huge difference to my state of being. It was unbelievable, and I could recognize that's what it was.
Right.
Yeah, Amanda, yes, I'm with you. Go ahead, Barb.
Yeah, and over here in my neck of the woods, in the ensemble I play with, vaccines not mandatory, so I had to make the tough decision not to do it. And
Yeah,
here's to the oboist, but sitting next to the oboist was unvaccinated, so I had to say no. At least
I would have
right
made
now.
that same choice.
At least right now. Maybe later.
Exactly.
Well, thank you everyone for doing that. What a fun way to really take what we've been talking about today and kind of put it together and hear from you. As you see, our lovely pictures of the virus here bring us into our final closing thoughts. In just a moment, we're going to stop sharing the presentation, and then the task force is going to come back up, and we're going to just chat for a little bit. And as we do the chat with our closing thoughts, if you have questions, please feel free to drop those in the chat. We want you to continue to look at the COVID resource pages. We still are adding information. As a matter of fact, in the next couple of months, this will be part of the information. This presentation is going to serve as our October update. So it'll be placed in the AMTA YouTube channel, and then we'll place a link to the presentation on the COVID resources pages. And then we're also going to be putting together some information to help music therapists start to shift as we begin to move from a pandemic phase to an endemic phase. And what does it mean to live in a world where COVID is here, at least for the foreseeable future? And what does that mean on thinking back to the ethical decision-making, the public health perspectives, the continued trauma that people experience, isolation and things like that? What does it mean for us as music therapists moving forward, and how we change our practices, our choices, what we're teaching students, and so on. Right? So with that, I'm going to ask Andrea to get everybody back up, and we're going to just share some closing thoughts with you all. And again, please drop any questions you might have in the chat as we do this. And Andrea's placed the whiteboard in there if you'd like to grab it. So that's available now. So Petra is on it as usual. Petra, thank you. Her question is, where do we stand with the relaxed policies of providing telepractice, telehealth services across states and countries? And are there any updates on reimbursement opportunities forward? So Barb, you want to kick that off?
Yeah, Petra, that's a great question. We have focused on the first part of your question on telehealth practice and telehealth services within the United States. We've focused our attention there, but we are a global practice. So I understand that. And we haven't looked internationally into that question, but I want to take note of it and do a little research on it and follow up with you, excuse me, too, as well. In terms of reimbursement opportunities for telehealth and telepractice, this is where we are interfacing with the government relations team. That was one of the topics in their federal update that I had made notes of, that we go back and forth on, working with Rebecca Preddy and Judy Simpson in particular. Meanwhile, we do scans and checks through the federal law system, but much of this is driven at the state level. But we are following the CMS side of it. And so I'll make a note of that, of making an opportunity. Don't have the answers to that, but I think it's a great and important question. To keep music therapy services in essential category as we move forward, because if and as we move to an endemic type phase where things might be fine in one area, but a population in another part of the world is affected, we need to be able to shift back and forth and understand how to bend and bow and not break.
Yeah, and Rochelle, I wanted to see if you had anything to add, given all of your interaction with the MTBO community.
Yeah, I will say that it's much easier to access HIPAA compliant telehealth platforms now than it was at the beginning of the pandemic. For example, on Zoom, it's possible to sign a business associate agreement or a BAA with just a basic paid plan now. So music therapists should be getting HIPAA compliant plans if they're doing telehealth. That was one of the loosened restrictions that we were anticipating would go away eventually, but that problem seems to have been solved.
Yeah, and updates on that are posted federally at the OCR, Office of Civil Rights. Is it OCR? Right, I think it's OCR. And I will pull that link and we'll add it to our COVID update page so people can see that.
One of the things that I'd like to highlight in terms of what Barb and Rochelle both pointed out is, the task force has been working together for the entire time that the task force has been existent, but we regularly pull in or connect with or work with other members of the music therapy community to make sure that we're getting the information that we need. And the government relations folks have been some of our most frequent partners, so to speak.
On the international realm, especially as we move towards the World Federation with our friends in Canada, and we have music therapists that, on David's up north on the border, near the border there, we crosswalk on both borders. I think, Petra, your question's an important one, and in terms of telepractice, because the regulations and rules, it may in fact be quite different in the EU versus other countries in the North American.
I can speak to the additional question about the international community. We have been connecting with the World Federation very regularly with their Global Crisis Intervention Committee. And as a matter of fact, David Knott and I had the opportunity to do a telehealth session, or not telehealth, a Zoom session, excuse me, with some music therapists in Brazil. David, would you like to talk about that a little bit?
Sure, thanks, Lori. Yeah, it was, we were invited to share with the Brazilian music therapists some of our strategies for how to develop and provide those telehealth resources. And so we did that, but I guess my own reaction was feeling a lot of inspiration from the hard work that those folks have been doing, and hearing some of the situations that they had been facing trying to provide services in remote areas with populations that had lost power, had some case lost access to food, were really struggling. So yeah, I think this is a really good point, Amanda. It's an opportunity for us as music therapists here in the US, being able to reach out and communicate with music therapists in other areas and finding where we can intersect with them, where we can support them, and then also where we can learn from their experiences. Yeah.
Petra has her hand up.
I'm coming online for 1 second. My question was also coming out of the situation that we actually had a client telesupervising a student with a client in Guatemala. So meaning our music therapy students are also now having clients international. And so the question is how we are going to handle this in the future in terms of legal policies and so forth. But why I'm actually coming online is I really, really want to commend Dr. Laurie Gooding as the chair of the COVID-19 task force and all of you of this task force for what you have done for the music therapy community and beyond, because your resources are available for everyone. You have no idea what kind of AMTA benefit this has been for me, and I think for many of our colleagues. So from research to education and practice and the not plug three-tiered model, I think this will be probably the most cited article in 2021. You have no idea what you have done for us and good of giving us a theory to talk about our work, to package it and to advocate for our profession and so forth and go forward with it. On a private level, I have to say, because of your information, I got a vaccination appointment early on when even the public health authority here in my county did not have any information. So I think you have done a tremendous job and ongoing. And so I think this was fantastic. And so kudos to all of you, and tagging on to President Williams' comment in the chat. Thank you very much.
Thank you, Petra. That has been our goal, is to support the entirety of the music therapy community. So I also want to take a moment here and read Samuel's comment. So it says, at the intersection of music therapy and public health in the era of COVID, I see two opportunities. Music interventions can be better at delivering culturally relevant, factual information than other public health campaigns. And the second, we are skilled at facilitating dialogue between disagreeing parties, such as conflict between health professionals and vaccine hesitant public in rural areas. Are there any music therapy efforts nationally to address these issues? Those are both great points and questions. And these are things that we've talked about as a task force. There's nothing, I don't think we have anything organized yet, but that we do have the information on the procedural support, which is in a similar vein. And so not exactly speaking to what you're talking about, Samuel, but heading in that direction. And I think this is part of our conversations. We've already done the initial stages of the endemic focus. And I think these are the exact kind of things that we're going to be talking about as part of what we want to communicate for the more endemic side instead of the pandemic. Seneca, were you going to say something too?
Sure. I was just going to say, and maybe even pass it to David for this. But for that first point, Sam, the COVID-19 task force, and particularly Rochelle and David, coordinated a songwriting campaign, which actually delivered advice and factual information, via a culturally relevant way through songwriting. I'll pass it to you two to talk a little more about that.
Thanks, Seneca. We're on the same wavelength because that's exactly what I was thinking. So I don't know, Rochelle, maybe you want to share a little bit about that?
Yeah, so this was a project that culminated a year ago, and we talked about replicating it. Maybe we will, maybe we have time for that. I don't know. But we have a collection of all of those songs that were contributed to the contest, as well as a sub list of people who won the contest. We have songs in Spanish, we have instrumental pieces. So there are quite a library of music that was contributed by members of the music therapy community. So it's a starting point, and it's a reference or a resource that we can use to offer to the community throughout the country and the world. So that's one effort that we've been able to make in educating the public through music about topics related to COVID.
I want to thank Sam for his comment, and really stimulating our thinking on it, because it's this kinds of feedback that really get the discussion going within our group and beyond, so that we can draw people in. And thanks a lot, Sam.
Yeah, and we are just at time, so I will wrap it up by echoing what Barb just said. Probably 90% or more of what has come out has been in response to people reaching out to us and us really trying to listen to what the needs of the community are, whether that's on the provider side, on the educator side, the student side, the client side, or all of the above. And so we are so thankful for you all for being here. We're thankful for you all reaching out to us and sharing information. We wouldn't have what's available if you as a community didn't share with us first what you needed. And so I will end today by simply saying one more time, thank you to these brilliant and wonderful people on the screen. I have come to love each and every one of them. Some of them I didn't know before this, but I value all of them tremendously. And as you can see today, it's very much a collaboration and very much a hive mind, think tank, group think approach to everything we do. Yeah, and sometimes that mind gets a little wonky, yes, but we go that wonky route together. So thank you again, and reach out to us if you have questions or anything you feel like we should consider moving forward. Bye, everyone. Thanks so much for coming.
Thank you, everyone.